Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I'm talking to Dawn Hunter, Deputy Director of the Southeastern Region for the Network for Public Health Law. Our topic is the national movement to declare racism a public health crisis and its implications for efforts to address the disproportionate harm of the COVID pandemic on minority communities. Let's listen. Thank you so much for joining me. Now, you've been studying these declarations of racism as a public health crisis.
Yes, a colleague and I, Betsy Lawton at the Network for Public Health Law, we looked at 24 of the original declarations that came out earlier this year, but that actually also included 2 that were issued at the end of 2019. And we looked at what cities and counties were committing to in declaring racism a public health crisis and tried to find some common themes.
Now, are these cities and counties located in one part of the country, or is this a national kind of movement?
They're all over at this point. Declarations have been issued in over 30 states, 160 cities, counties, organizations, at every level, including a handful at the state level via, for example, executive order by a governor. But most of the action has been at the city and county level.
And do you know which one was the first?
The very first. So actually, prior to 2020, one early example is Anne Arundel County. And forgive me if you live in Maryland and that's not how you pronounce that county. But
Anne Arundel.
It is Anne Arundel. Okay. That was one actually in the end of 2019 that had issued, or actually might have even been a little earlier, that was actually in response to a report they did on hate crimes and bias in their community. And then a lot of the declarations that have been issued this year have been in response to the death of George Floyd earlier this year.
And tell me what's in a declaration of racism as a public health crisis?
So a declaration is a statement basically of intent saying we're going to address racism as a root cause of health inequities. It identifies the kinds of things that they want to address, for example, housing, intergenerational wealth, employment, and other related issues, and then some strategies to address racism and to address those individual topics.
Is one of the main purposes to kind of open people's eyes to the health impacts of racism?
Well, absolutely. To call attention to racism and recognize it as a root cause. That helps to allocate resources and attention to it in a way that hasn't really been done at this level before, not with this much momentum.
And you mentioned the one example of a hate crime report leading to this, but some of the links between racism and health aren't as overt. Is that fair to say?
Potentially, they're not as overt, right? And so you don't have to have a report to have recognized that there's a connection between outcomes that people are experiencing and race being a factor in those outcomes.
Yeah, and I guess, it's not just through hate crimes. That's not the only way that we see the impact of racism on health.
Right, absolutely not. In fact, one of the most obvious ways that we see the impact of racism through health is in healthcare.
Tell me more about what you mean.
Well, people of color, Black people, Hispanic or Latino people, and American Indian people experience different, worse health outcomes than white counterparts across a variety of measures. Probably one of the most prolific examples is in infant mortality. No matter, the mother's level of education, age, income, Black women and their infants experience a significantly higher mortality rate than white women and infants that are similarly comparable.
And so part of that might be the kind of healthcare they get. Part of it might be social factors in the environment that contribute to worse health outcomes.
Right. And it's, partly institutional. So it's sometimes you mentioned interpersonal. So it's the experience with the provider. It's also the institutional practices and the way that the institution approaches patient treatment and patient care. But it's also the system. So, where are healthcare facilities located? How many physicians and clinicians and other providers are available in a community? Are they trained on cultural competency and how to interact with people from different backgrounds and in different literacy levels? Those are all factors in how someone's health is impacted.
And you're seeing all of these different relationships reflected in some of these declarations.
Right. And it goes beyond healthcare, because we also see the effects of racism, for example, in housing. And the historical impacts of racism in housing have led to people of color being concentrated in neighborhoods that are under-resourced, that are near environmental hazards, for example. And those are all things that actually place people at greater risk for development of infectious and chronic diseases.
And there's also nutrition and access to safe and healthy foods.
Access to safe and healthy foods, access to safe and healthy neighborhoods. So whether or not people live in a neighborhood where they can walk outside and exercise outside, have access to public facilities, those are also, part of the determinants of health. And so these declarations really recognize that racism has its touch on so many different aspects of people's lives. And really, to meaningfully make improvements, you have to address all of these different areas. And you have to recognize, in particular, from my perspective at the Network for Public Health Law, the role of law and policy in creating and sustaining those inequities.
I don't want to leave out the role of the criminal justice system, especially given that you mentioned that a lot of these declarations have been triggered by the murder of George Floyd.
Absolutely. The murder of George Floyd and so many other Black men and women and other people of color, Indigenous people included, who have been murdered due to police violence. I think that has drawn attention to the criminal justice system in general and highlighted things that we have already known, which is that people of color are incarcerated at higher rates. People of color experience more barriers to re-entry upon release from incarceration. We see now that people of color, have, even prior to COVID, inadequate healthcare within prison and jail systems. Those are all things that are significant problems that need to be addressed as well.
So we have all these places now calling attention to this challenge. What do the resolutions do to take action against them?
So one of the most important things that the resolutions can do is actually lead to concrete action. So by making this formal commitment, it's a way to direct resources, to create task forces. That's one thing that's pretty commonly recommended. To create new partnerships, to commit to studying organizational policies and practices. Those are all examples of actions that cities and counties have committed to take.
So I want to talk for a minute about another crisis that's happening, which is the pandemic, the COVID pandemic. How has the declaration of racism as a public health crisis intersected with COVID, which we know has a significantly disproportionate impact on racial and ethnic minorities?
Well, these declarations also, in addition to recognizing the aspects related to the murder of George Floyd, also are related to the disproportionate impact of COVID on communities of color. So we know that Black and Hispanic or Latino and American Indian people are dying at higher rates, are being hospitalized at higher rates, and have higher cases in many states. And those also help spur declarations in these communities, but they also led to the creation of disparities task forces at the state level in a number of states, about half the states so far.
So the disparities task forces may be a way of taking this concept of racism as a public health crisis and applying it to the COVID pandemic.
Absolutely. So it is recognizing also the role of racism in health outcomes. And these task forces have been tasked with many of the same things that cities and counties have committed to, but that's really identifying, researching, and providing the data for how racism is impacting health outcomes, and then identifying concrete steps that can be taken to help address that.
So, I think of what does it mean to tackle something as a public health challenge? One of the first things it means is to really make sure you have good data. And so do you have a sense that these task forces on COVID are focused on really surfacing data to show the impact of the pandemic?
Absolutely. Most task forces have committed to better data collection, more standardized data collection. One of the problems that we have is that there can be variation within a state on data collection, for example. And also collecting broader data that tells us more about how communities are really impacted. So not just age and gender or race, but also income, also sexual orientation or gender identity, housing stability, measures of housing stability, and homelessness. So these broader data pieces on social needs that also tell us more about who is impacted by the pandemic.
I think once you have that data, you can start thinking about both programs and policies that could make a difference. So I asked you in the area of COVID, as these task forces are looking at racial disparities, for example, in COVID, what are the kinds of programs and policies that they're focusing in on?
Well, one of the most important was really early and throughout the pandemic is using the data that's been collected to direct resources to communities that are in need. So that's testing and provision of PPE, masks, and things like that. But also looking at resource allocation through the health system in terms of when cases have risen and hospitalizations have risen, planning for care in those communities for both COVID and non-COVID situations. And there's also looking at, a couple of states have looked specifically at how to protect pregnant women, ensuring that we have equity in birth outcomes during the pandemic and recognizing the particular risk that pregnant women might be experiencing.
What about some of the more structural factors that are producing greater risk? So just like you were saying before with racism as a public health crisis, you've got the healthcare part of it, and then you have these structural factors outside healthcare. What's emerging from the discussions of COVID and race that relates to these more structural factors?
So one of the things that's emerging is just a conversation around healthcare access and access to benefits in general. So what kind of laws and policies ensure that people have healthcare, have access to food and nutrition, have access to transportation, have workplace protections? These are all things that really are set by law and policy. And so these task forces are looking at, do we have equitable laws and policies in place that ensure that our response will benefit the people who are being most impacted, most negatively impacted?
So just to pick one off your list there, workplace protections. Tell me a little bit more about that.
So workplace protections include things like paid sick leave and hazard pay for frontline workers, and also discrimination reporting processes and other reporting processes for noncompliance with workplace safety. Workers have to have a way to report conditions that jeopardize their safety and health and ensure that they will be followed up on. And so states can pass laws that address those different areas.
And by doing so, they're not only reducing COVID for everyone, but they're particularly focusing on communities that have suffered significantly, because one of the reasons those communities have suffered so much is the lack of workplace protections.
Right. Because we know that, particularly in some jobs, that people of color are overrepresented relative to the population. And so, Black and Hispanic or Latino people in particular are more likely to work in some of the frontline jobs and some of the direct healthcare jobs and healthcare support positions. So absolutely, these changes will benefit those populations, but they benefit everyone. We all could benefit from having a safe and healthy workplace. And so states really need to prioritize laws and policies that ensure those conditions for everyone.
So I wonder if the general resolution on racism as a public health crisis helps people understand the work of these task forces about COVID and maybe will help people follow through on their recommendations. I wonder, what do you think about that? If people have in mind that it's really important to address racism and they see the example of COVID, maybe that will help push through some of these policy issues. Is that being too optimistic?
I don't think it's being too optimistic at all. I think, in fact, COVID, for how terrible it has been, has really helped to drive to the forefront as examples of ways that cities, counties, and states can take action and intervene to improve not just the experience that people are having during the pandemic, but also put in longer-term solutions that will benefit communities, benefit individuals over time. So, putting in, for example, paid sick leave, yes, that's absolutely something that's critical for the pandemic, but it's critical in general to ensure a healthy workforce. So I absolutely think that related to COVID, and these declarations, that it normalizes the conversation. It tells people, yes, absolutely, you can take this into account and figure out strategies that will reduce the racial disparities.
Got it. And you'll be there to keep an eye on all this work happening and really assessing what of these plans and declarations are the most impactful.
We're absolutely looking for the most important thing next is really to see how cities, counties, and states actually take action. So I would say, the three important things that we would see are, number one, resource allocation. Is funding being directed toward making improvements? Two, I would say, I would emphasize the role of community in decision-making and informing all kinds of processes, especially during the pandemic. The community has to have a way to voice its perspective on what it needs. And then I would say, that these declarations can help, and these task forces in particular, can help drive examples of actions like policies and laws and organizational changes that do work, and then hopefully can be scaled up and shared.
Great. Well, thank you so much for joining me to talk this over.
Thank you so much for having me on the podcast today.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.